Hi, this is Dr. Michael Brisman, neurosurgeon from Long Island, just sharing some interesting cases with you. So this case I'm going to show you is a patient who's 67, a physician who had some headaches, and this tumor may well be an incidental finding, but this is the MRI post-contrast axial of a tumor that looks like a convexity meningioma with some cystic components to it. And there's not much edema. And again, I don't think she was really having much symptoms, if anything, maybe a little headache, but it wasn't clear. And the tumor had been getting a little bigger on serial imaging. And as a result, I think there was thought that this should be treated. This is another image showing the coronal post-contrast MRI image, and again, showing the abnormality right here. And, discussion was went to whether we should do standard surgical craniotomy to remove the tumor, or the other alternative was to do a focused radiation or radiosurgery treatment, which can be done if the tumor isn't too big. And we thought that this was still within range of that. So, she was a physician. She was very well educated. We discussed things, and she decided that she did want to do the radiosurgery, the focused radiation. And because the tumor was moderate in size, I thought it was better to do it over 5 sessions with a linear accelerator machine I used called the Novalis TX, rather than with 1-day gamma knife treatment. So that's what we did. This is the treatment planning, which again shows the treatment around the tumor, the rapid fall off around the tumor. This is the axial, and this is the coronal treatment plan. And this was treated in over 5 sessions. Outpatient. She did very well. She clinically had no problems, and over time, these are MRIs several years later, showed the tumor. We followed it closely. It got smaller. Here on the axial, it's smaller. This is the coronal. It's smaller. And so again, I think this is just a nice demonstration of how meningiomas or brain tumors, even when moderate in size, can be treated with radiosurgery very effectively without the need for open surgery, and patients can do very well. Thank you very much for listening to this interesting case.